But welcome everybody. This is PASS's Spring Town Hall. PASS is a nonprofit organization dedicated to the health and safety of adult industry workers. We create health and safety policy, including infectious disease testing guidance for the adult industry production. PASS is governed by a volunteer board of directors. We're entirely funded by volunteer donations, and we don't make any money from testing. My name is Ian O'Brien. I'm the executive director for PASS. I'd also like to introduce our other panelists today. The gentleman in the lab coat is Jamey Bell, a board member for the last several years. I don't know, it's been a while. And our medical director. The gentleman with the bookcase is Jordan Holberg, our chief technology officer. So we got a cute little presentation for you today. I'm going to jump into that and move on to the agenda. All right. You see that? We're good? Good, perfect. I love when technology works. All right, there's town hall. This is just our names in case you are a person who likes to read things as opposed to hearing them. Our agenda for the day. So we've got a pretty simple one this time. I was just telling Jordan that I'm grateful that this feels like the first town hall in a while where we're not responding to an immediate crisis. With that said, I think a lot of what we're going to talk about today is what is happening behind the scenes to kind of set us up and prepare us for the future. We've committed to doing quarterly town halls. We had one as part of XBiz Los Angeles back in January. This is the one we're doing for spring. We'll also have one in the third quarter and winter to give regular updates to the industry so that you're able to see kind of what's happening behind the scenes. It doesn't feel like we're just showing up whenever there's something happening to the industry. And we can kind of build the robust infrastructure that we need for our health and safety. So this is the beginning of that. So the folks of you who are curious about things, we're here for it. First, I'll go through some general PASS updates. I'll hand it over to Jamey to talk about what the Medical Advisory Board has been discussing and kind of what's on the horizon there. Jordan will talk about how we've been improving and our plans to improve the database and really looking through how insecurity has been increased and will be increasing. And then we'll open up for a question and answer session at the end of that. If you could please save your questions until the end, I would appreciate that. Or I guess you can put them in the Q&A thing in the webinar feature and we'll just answer them all at the end of this. I don't think that's disruptive. All right, so quick PASS updates. I just spoke about our quarterly town halls as a part of that. Again, this is just an effort to be more transparent and communicative with the industry. We're creating guidance around health and safety that often feels like it only occurs when there's a crisis happening, but a lot of what needs to happen as a community is the slow and kind of boring work of making sure that our communication channels are open, people understand how decisions are being made, that we have the appropriate policies in place to respond to when things are happening. So that's part of this. The next thing I wanted to mention is PASS certification. We launched a studio production certification program in the beginning of January. For folks in production community to agree to a set of 4 simple rules. We've been moving that program along. We're still interested in recruiting more folks, and you should be hearing more about that in the coming month or so. I also want to say that a new PASS testing partner will be launching later this month. We're hoping to have finalized details by today. We don't yet. But in the next couple of weeks, you should expect a new lab to be available for folks to test at within the industry. It's some pretty exciting stuff. There'll be some really, we'll be able to provide more access than we ever have before. So we're pretty stoked about that. And the last piece, just some upcoming events. We'll be hosting a panel at XBiz Miami for Content Creator Health and Safety 101. If you're attending XBiz Miami, please come check that out. And also at the end of this month, we'll be hosting a comedy fundraiser. We won't be hosting, someone will be hosting on our behalf. A comedy fundraiser at the Flappers Comedy Club on May 24th. This is by Sunday Fair, and I believe Aphrodisiac Wellness. It'll be feature industry comedians. So please check it out. If you need information or tickets to it, email us, find us on social, and we'll be able to facilitate that for you. Additionally, Sunday Fair, if you don't know, has a industry community event for folks in the industry the last Sunday of the month. We've been attending for the past several months. Jamey and Adam have had a little booth and answering health questions, but there's all sorts of stuff available for the industry there. So please check them out. Now, with that said, Jamey, I'm going to pass it off to you and have you give some updates on the medical advisory board stuff.
Great, thank you, Ian, and thanks everyone for joining us today. For those of you who aren't aware, PASS has a medical advisory board, which is comprised of infectious disease specialists, physicians, laboratory scientists, nurses. We have a couple talent representatives. With that, if anyone with medical health science backgrounds, working talent is interested in joining the medical advisory panel, please reach out to us. We definitely would like more representation from talent who have that background. The advisory board met about a month, 4 to 6 weeks ago, and reviewed our current policy on MGen. And we had consensus that the 30-day testing recommendation seems to be working pretty well. We came to that decision after a lot of angst on, how we should proceed. We don't want to test too frequently or too infrequent. So 30 days seems to be working. That takes into consideration for folks who test positive for MGen that the treatment protocol is 14 days. And then we want to allow some time for clearance of the bacteria so that we can hopefully eliminate false positive results following treatment. We've been doing a lot of education around appropriate treatment, and it seems that has improved quite a bit from when we started. There's a lot of variations depending where a person's getting treated, but we're really trying to stick with the CDC recommended protocol for treatment to help minimize potential drug resistance. Here it's very important to not include Mycoplasma hominis or ureaplasmas in the test. Those organisms can normally be colonized in urine and should be left alone unless they're causing problems. So we really want to focus solely on MGen with this policy. We are also in the process of looking at the current testing panel and looking at where we could potentially make revisions, recommendations, maybe some tests that don't need to be done as frequently or could be optional. So that is in the works now with our medical advisory panel. The other thing that we will be working on is some education and guidance around working with HIV positive undetectable performers. So we get a lot of questions about U equals U, or undetectable equals untransmissible. So we really want to get some education and guidance out there to help folks feel more informed and more comfortable if they are working with HIV positive undetectable coworkers. And let's see, anything else here on the agenda? I think that's pretty much the update. Our plan is to meet quarterly with kind of maybe some breakout type sessions in between as needed if situations arise that we need to address more immediately. But we're really excited to have such a great panel of experts who are very committed to the mission of PASS and protecting the health and safety of the industry. So, thank you.
Jamey, would you mind speaking really quickly on Mycoplasma hominis and ureaplasma? We've gotten a number of questions recently about them and how they relate to MGen and how they're different.
Yeah, sure. So those organisms, depending where a person is testing for MGen, there can be what's called a mycoplasma panel, and it has these various organisms included in the panel. So Mycoplasma hominis, ureaplasmas, there's a couple different types. Those can be found what's known as colonized in urine, meaning they can just be present, causing no problems. Just like we could find strep in the urine, for example. And we don't treat those organisms unless a person is symptomatic and they're causing issues. So they're also not something that should be routinely screened for as part of sexual health. Those are more diagnostic tests that would be done by a medical provider. So for example, if someone is having ongoing, persistent symptoms, we've ruled out the more likely culprits, chlamydia, gonorrhea, MGen that we're now including. It might be appropriate for a medical provider to then order those additional labs to see if perhaps they're causing the persistent symptoms. But they really shouldn't be part of a routine screening, for work clearance. Generally, they don't cause any problems. They're just found. Over treating those more benign organisms can increase the potential for antibiotic resistance. So, if it gets to that point where there's unexplained persistent symptoms, then I recommend folks see a medical provider for evaluation. And whereas Mycoplasma genitalium is considered a sexually transmitted infection, so that we do want to treat and reduce the transmission, the prevalence in the industry community.
Awesome. Thank you so much, Jamey.
Sure.
All right. So thank you for the medical update and moving quickly. Next, we're going to move to Jordan and what's going on with the PASS database.
Sure. Thanks, Ian, and thanks, Jamey. So hello to everyone who may not even know I exist. I do exist, and I'd like to let you know that stuff is happening behind the scenes. The PASS database that you access probably doesn't look any different than when you've used it in the past, but a lot of things are happening behind the scenes, primarily focused on security improvements for both the system in general and around privacy, which is paramount to this industry and to your health data. To that effect, we've been modernizing the code base. It's actually undergoing a full rewrite at the moment with incremental changes that have been rolled out live. And that full update includes migrating to a new server, which is industry standard and comes along with all the protections that you would expect for something housing this type of sensitive data. To that, you're also eventually going to move all of you over to two-factor authentication. And you may be familiar with that with other services you use with either a text message coming in saying, please enter this code, or with something like Google Auth or Authy, where an app on your phone is telling you a code that you need to log in. We currently have that for our administrative users because we have access to everyone, but doing this to move to an individual will make sure that if your password gets compromised, someone still can't log in and access your data unless they also have access to that second factor, be it your phone or your phone number. And then finally, everyone has a pass ID. It's your number that appears in the upper right-hand corner. That hasn't really been used very much across any of our facilities, including testing facilities or internal checks and balances. We are going to roll out a pretty comprehensive program where your pass ID, your number, will be the key to your data. And that'll help normalize information sharing between the labs and us, as well as keeping any sort of errors or deferred tests, as we like to call them, when things don't quite match from what the lab has given us, to a minimum. And this will also set the standard for a whole bunch of stuff that we're not quite ready to talk about yet, but will be coming in the coming months and year. I just want to let you know that I am here. If you have questions about security or how the system works or the API or how your data is stored or anything else involving the technology, as long as it's not related to the actual health technology, because I am not a health expert, I'm a nerd, computer nerd, feel free to reach out to Ian, me directly on Twitter, wherever, and I'm happy to be as transparent with you as possible to make sure you know what's going on with the systems and your data.
Beautiful. Thank you so much, Jordan. So that was the quick and dirty updates of what we're going through. We wanted to give a lot of space for questions here, to answer some specific stuff that's already come up. So please type anything in the chat that you'd like. We want to make sure that folks' questions are addressed. The first thing that I wanted to bring up was we have a question about faked test results, and the understanding that there's been an uptick in them recently. So this is something that PASS is well aware of. It's something Jordan and I had many conversations about. I think this is something that we're addressing on a number of levels. The one is like increasing coordination across the labs and PASS. A second is a lot of the database security improvements will help ensure that have a lot to do with identity verification and understanding who is going where and why. So that'll be a factor in addressing potential fake test results. But Jordan, did you have anything else on that? No, we're making improvements in order to address it. I think it's something that can happen at a technical level. It also is going to happen at a policy level. Just streamlining systems.
I think we've got a lot of ideas between the two of us and looking at what's happening and how to make sure anything we do is user-friendly and easy to understand and make sense. So we're not idle when it comes to this at all.
Yeah. Stacey asked if someone fakes a test and TTS informs us, are we able to ban the individual from our system? We are able to omit results from specific individuals. So if we have information on like name, email address, things like that, where it is easy for us to set up an account and have them banned in the system. So that like we can communicate that information out to other labs But right now, as it stands, like once we have that information, they cannot be cleared in PASS. And this is another benefit of the PASS database, is that we can centralize that information, and regardless of whether or not other folks are compliant or follow through or look at it, we can centralize it in one standard place. So if you're checking there and someone is not available to work, they're not available to work. And so, yes, we can use the PASS database currently to prevent folks who have been flagged as being potentially or having compromised tests from being able to be cleared in the PASS database. Another question from Stacy: which tests are we considering or changing the frequency of?
Take that, or
yeah, please.
Oh, okay, sure. Yeah, thanks, Stacy. Great question. So right now we've been focusing on the hepatitis test, the hepatitis B surface antigen, as well as the hepatitis C antibody test in terms of the frequency. We also know that a lot of folks have been vaccinated for hepatitis B. So that's something we, are considering maybe having that as part of the database. Folks who have been vaccinated don't need to test for hepatitis B. Also, the frequency, as you probably know, I mean, with hepatitis C specifically, it can take up to 6 months to develop antibodies. The risk through sexual transmission is actually low. And I mean, there are certain genres that might increase the risk if there could be blood to blood direct contact, but really every 14 days it just is medically unnecessary for hepatitis C antibodies. We would have to come up, generally recommendations are an annual test. But we also would respect that some people may want to test more frequently, pardon me, depending on the types of activities or the individual risk factors. And so that would always be an option. But in terms of immediate work clearance, it's one that we just feel like it's too frequent.
Several of the other things we're talking about is the granularity of testing and the really like the specific assays that we'd want to be using, and diagnostic criteria, kind of standardizing that across labs. Some more like contractual stuff and like medical dirt stuff, but this is the preliminary phase. We just wanted to talk to the industry about it, kind of what we're considering and what we're like the pathways we're moving towards. Awesome. All right, we got another question. This person is new to PASS. They said we don't collect fees from our testing partners. They want to know why it costs so much, and why they don't accept insurance. And they pay $30 at one facility, and there's another place they go to that's free. So that's a fantastic question. And there's a number of answers there, talking about or thinking about health systems in the United States, and our testing specifically. The biggest reason is that we use, and the industry uses, a standard panel that is unique to the risk, both medical risk and legal risk of the industry. So when you go and get tested at most places for STI testing, they're only going to do a certain panel of tests based on your unique risk profile, for somebody that is at most testing every 6 months. So the big one is the HIV test that is used in most clinics is what's called an antibody antigen test. It's one of the tests that is currently on the PASS panel, but only one. And it has a longer window period or ability to detect HIV than the specific PCR test that we use. And that test is, because they're screening a general population, much cheaper than the PCR test that we use for our industry, and we test every 14 days. The other reason is because we're doing that kind of boutique testing, we're not plugged into the same kind of payment systems that like clinical testing or like state or city clinic testing might be able to. So there are some clinics. I know the LA LGBT Center is able to provide reduced testing according to the panel. And I know a couple other folks have been able to bill insurance, but for largely, this is operating outside of whatever the payment structures are in place that would reimburse the cost of testing either through insurance or state programs. So it comes out of pocket. That said, figuring out how to reduce the cost of testing and make it more accessible and plug into those programs where we can take advantage of different funding sources is a big step that we're trying to take. And a lot of the work that we're doing behind the scenes, both in terms of the medical advisory board's panel revision and the kind of database improvements and security updates, are to make it so that we can get into a place where we can take more advantage of those systems, so that you don't have to be spending a couple $100 every time you want to get tested. Hopefully that's it. All right. Anything else? I'm happy to call a short town hall. This is the first time that I just haven't had panicked questions in the chat. I'm so stoked that we're able to just be a little boring today. All right. We've got nothing else. Again, this is just the start. We are planning to have these every quarter. The next one will be sometime in fall. We'll have more updates on what the work we're currently doing. You'll again be able to answer whatever questions you need or have of us. And in the meantime, if you need anything at all, please reach out via email. I'm Ian at passcertified.org. Jordan is Jordan at passcertified.org. I think Jamey is Jamey NP at passcertified.org. We threw that nurse practitioner thing on there because I mean, if you did it,
yeah,
slap it on. And you can also find us on Twitter or X. We're at passcertified, Jamey NP and Evil Jordan, and let us know what you need. Thank you all so much. And I hope you have a great rest of your day. And thank you so much, Jordan and Jamey, for speaking on this.
Pleasure.
Awesome.
Thank you.
Thank you, everybody.